I'm Jaron Fishbeck. I'm a family doctor here at Kachina Family Practice. I've been here for 2 years since finishing residency in 2007. You know, when I came to Kachina Family Practice, I had come from residency where we used an electronic medical record and went through that transition process with NextGen. And then I came over to Kachina Family Practice, and they were just right in the middle of switching over to starting an electronic medical record for the first time, and that's when I came to know Practice Partner. Dr. Mullins she'd decided on Practice Partner a couple months prior, and I remember my feeling of, oh my gosh, I'm married to this new electronic record and I have no idea what it is. I was not very comfortable at all with Practice Partner before we started. I had no knowledge of the product, and was pleasantly surprised after getting on board with them after a few months. Our first day of EMR was fun to say. It was a challenging day. There was lots of fears from the physician standpoint as well as from the staff, we thankfully were all in it together. We all came ready to work together, and none of us were dragging our feet. We were all ready to go with it, and I think our approach really helped us in the long run. Our approach to implementing Practice Partner in our office was we wanted to have the physicians be the principal players in terms of deciding how things would happen, and we wanted to make those decisions together, the four of us. And we had frequent meetings, huddles throughout the day. That first day we put our heads together many times, and I think that combined effort really helped us make a successful implementation. The first day we made a point as physicians to be all in this together. We wanted the staff to see us as motivated, as excited, and as invested in this new project we were undertaking. We wanted to have a positive attitude, and in fact, the first day, I baked some cinnamon rolls the night before and some sticky caramel rolls, and we made a big sign that said, "Let's stick together," and that was kind of the theme of that week, and because we really needed to stick together through that transition time. You know, some of our staff were reluctant, and we had to coax each other along and encourage them that some of the initial frustrations would go away, and they did. And so again, we had to just continually have a positive attitude, and that was the doctor's responsibility to be the lead from an attitude standpoint. Some of the people who were initially reluctant with Practice Partner with various features such as messaging, billing, intra-office communication, now have come to full circle and are big proponents of Practice Partner. If we were to do implementation again, there's not much that we'd change. I think our practice owner, Dr. Mullins, had a phenomenal vision of how things should go, and her vision was really key in making this a success. The groundwork was laid from things that were done 2, 3, 4, 5 months prior to the go live day. There was lots of things that happened behind the scenes that a lot of the staff weren't aware of in terms of purchasing hardware and setting up hardware and configuration. And I think we had a very tactical approach to implementation. The difference I see in now, practicing medicine now with electronic medical record compared to before, is my documentation happens real time. I document with my patients in the room, and I leave at the end of the day, probably 10 minutes after my last patient, whereas before I was staying an hour to dictate. To me, that's the power of an electronic medical record like Practice Partner, is that I can leave at the end of the day and go home to my family. My wife loves it. She's seen what it used to be like compared to having me be able to meet them at the soccer game right after work and not feel stressed that I need to stay and continue to do my documentation. And if I, for whatever reason, have a bad day, I can still leave right at the end of the workday and finish from home remotely any last-minute charts that I wanted to finish up on. I feel like our office staff is tremendously more productive using Practice Partner. They've converted everything from paper to electronic. They now wear headsets, and they don't have to write things on a sticky note and to have it lost and then found some other time. Everything is done succinctly, efficiently, and in a way that we can retrieve that information quickly at any place in time. I think the advantage for our patients with an electronic medical record in our office is that we as their physicians are providing better medical care. I think our medical care is more timely, our medical care is more accurate, and it's more efficient. I can manage diabetes in a much better way using Practice Partner than I did before using a paper chart, thumbing through the chart looking for that lab result. And I might spend, a minute doing that, looking for, whereas now I can find it with one click. My favorite feature of Practice Partner as an electronic medical record is the user flexibility to adapt and fit my style as a provider. The previous experience I had with a different electronic medical record was I was fixed into doing a certain document in a certain way. And with Practice Partner, the product can be quickly edited and adapted to fit your individual needs as a provider. Because Practice Partner is very editable and adaptable to fit your style, we've made several templates to fit our needs as a family practice clinic. And in fact, we've made 245 different templates that we use on a regular basis and have really improved our efficiency. The best advice I have for any practice ready to adapt to electronic medical record would be to be unified as a provider group in making decisions about implementation steps. Our success is founded in the fact that we were together as a provider group, as a staff, as a whole office, and that's probably the best advice I have to offer.